So this is Dr. Carl C. Cottrell. You might have heard of that, like Dr. CCC. So believe it or not, I have known Mr. Barris for longer than most people. We grew up in the same area. I was from Meeteetse, and he's from Cody. Don't hold that against us. But usually he comes in and brings everyone to show them some things in our office. And so scheduling just didn't quite work out. So I thought that I would just send a video of some cool things and he can show this, or he doesn't have to if he doesn't want to. Maybe it would just kind of sit there. So anyway, so we'll have a little bit of fun as I show you a few things around the office. And so sit tight. So in this room, we have what we call the Optomap, and it's called by Optos. Anyway, so this is an actual retinal camera that we use in the office. And so we bring patients in this room and then we take pictures of their retinas. And I'll show you a little more about that. But some of the pictures that we get, so this is like a healthy retina. And then we've got, if you look closer on this one, there's little hemorrhages like broken blood vessels. This one has some issues in the outside, like a retinal detachment. Just different things that you find that are unhealthy in the eye. This one is like a freckle that's gone bad. Anyway, so it's just pigmentation in the back. This one is actually really bad because it's a melanoma, so that's life-threatening. So we never ever want to see that. So if you look at some of these, you can kind of see from your anatomy of what you guys have seen in the past. This is kind of a normal freckle. If you see that right here, that's a normal freckle. And so those are just some things we look at or look for. So what we do with this is we bring patients into this room and we have them sit here. And then they look into this machine. And then actually we have, like, it's all computerized. And then we take the picture of the eye. And so then we get the pictures like this. So that's where we look to make sure everything's okay with the eyes. And so that's what we do in this room. So this is a room that you guys might be familiar with, but this is where we pick frames and people come out and look, for what they look good in. So anyway, so that's what we do there. So this is the main exam room where patients come in and sit here. And I'm kind of videoing, but then I have also my videographer, Diet, and you guys might know her as Toad. I guess that's appropriate, but
yeah.
Anyway. So this is the room where I do a lot of my testing in here. So this instrument here is what we call a phoropter. You don't have to remember that. I don't think there's a test on this at all. But what we do is I put a patient in this chair, and like I said, many of you probably have done this before, but I put a patient in here behind the phoropter, and then we tighten that up, and so there's a ghost patient here right now, but so this is what I do a lot of my time. I'll put lenses in, and I'll say, which is better, 1 or 2, and 1 or 2, back and forth, or I'll even go to, sometimes I'll go to 3 and 4. So anyway, so in order to be an optometrist, I had to have 3 semesters of college calculus. And that's crazy because I laugh now because I had 3 semesters of college calculus to be able to count to 4. And so I'm pretty good at that by now. So anyway, and just kind of an interesting note. So with this, I do exams pretty much every day, at least the work week. And I do probably anywhere from maybe 10 to 14 or 15 a day. So over my years, I've been an optometrist 25 years, so I've done about 75,000 of these. And so anyway, so sometimes it gets a little bit monotonous asking the questions. But the thing that I like the most is the people, because the people are always different. And so anyway, I can visit with them and kind of joke with them a little bit about it. But anyway, so that's what I do a lot of my time right there, is just to see how they're focusing and checking on that as well. So with the eye model that I do use to show people, when we do the phoropter that I showed you earlier, when you do the testing, you want to make sure that the images that we see focus right on the retina. So when I do the testing, and I mentioned this earlier, like which is better, like 1 or 2, I'll put in different lenses. And so that's what I'm doing to try to focus in the back. And so that's very important. And then and we'll talk a little bit more about some problems with the eye that can happen too as well. So, ready?
Yeah.
Okay, so a lot of my time as an optometrist, I spend showing people the anatomy of their eye. And so I use this eye model actually all the time, every day. And so you guys have been studying that, and that's why, you know, sometimes as you get into the eye part of the anatomy, that's kind of my forte, that's what I like, and that's what I do. But if you look at the eye, and you've studied this too, but you have the front, which is the cornea, okay? And then as you go through the iris, so that's what makes your eye the color that it is. So in this particular model, it's brown, okay? And so those, and it's kind of a genetic thing, because those, if you have, you know, blue eyes or brown eyes or hazel, a lot of times it's coming down from your family and the genetics, and that's another course, you know, as far as what we talk about. So then right behind that is a lens, okay? It's called the crystalline lens. You guys have learned about that, I'm sure. But it's actually, when we're born, it's usually normally just very clear, like this, okay? And then I'll visit with you more about some things about that. But then as we go back through the eye, you've studied this as well, but here's the retina, okay? And then we have the optic nerve. So the optic nerve comes back out of the eye, and that's where that'll hook into your brain, okay? Then all of the blood vessels actually come in with the nerve, and then they branch out. So that's the basic anatomy of the eye there. One thing in particular, so right in the middle, there's kind of a little bit of a divot right there, and that is what we call the macula. And so you might have heard of macular degeneration. It's usually elderly patients or older patients that come in. That whole area is kind of thinned out, where it's kind of splotchy, and you can see in the images where you find macular degeneration. And it's kind of hard because people will lose their central vision, and their periphery is still good, but centrally they just can't see as well. And so kind of a side note on that is, if you ever go to like the nursing home, or maybe you might have grandparents or something, that if they're looking at you to the side, kind of like this, and they're trying to talk to you, sometimes it's unnerving because you're like, wait, who are you looking at? But we actually teach them that their peripheral vision, so the outside of the vision, is actually the part that they can see out of. And so they look to the side because they can still see in the side vision, but when they look straight ahead, they can't see straight ahead. And so sometimes it's a little bit different to talk to people with macular degeneration, but it's very normal to teach them to look off to the side, because the center here is completely, sometimes you can't see anything right here. So if somebody were to come to me and you say, you know what, I'm seeing something really weird in my right eye, right out here. So we would take an image with the Optomap or the Optos machine, and it actually scans the eye from here all the way around to the outside, about 270 or so degrees. And anyway, so we would take the image and find out what part of the eye is causing the problem. So for instance, if I was seeing something really weird here, we would look and see what's causing the problem. It could be just a floater, it could be a tear in the retina, or some kind of a detachment. There's a lot of things that can cause that. And so the health of the eyes is actually very important. So with that, some of the most common things that I see as an optometrist as far as eye health, we find that a lot of people have cataracts, and you probably have heard about that, or maybe somebody in your family has had cataract surgery. Sometimes people think that cataracts is like a film that's over the front of the eye, but it's actually not. It's actually inside your eye. You have a lens, that lens we talked about, the crystalline lens, that actually turns really cloudy. Okay, so you can kind of imagine that if you look through that, it's going to be hard to see. And so everything that we try to see, we try to come in focus on the retina, but it's really hard if the lens inside the eye is cloudy. And so what they do is the surgeons actually go in and they actually take two instruments and they go in to the eye and they remove the lens that's all cloudy, and then they actually replace it with a new one. Okay, so then it clears everything up for those that have had cataract surgery. Now, one kind of a cool thing about that is the other day, Candace, my wife, asked me what I wanted for my birthday. And I said, I want cataracts. And she's like, what are you talking about? And I told her, I says, you know what? When they take out the lens that's all cloudy, they replace it with the new one. But when they do that nowadays, they can make measurements and they replace it with the lens that actually coincides or mimics our glasses. So in reality, when I have cataract surgery, when I get older, they can take the lens and put the power of my glasses in the lens and put it in my eye. And so in theory, I'll be able to see without glasses, which will be amazing. And so that's why I want cataract surgery. And so it's a pretty amazing situation. So now just a few more things with the eyes. So the cornea, a lot of times we'll find people that will get something like embedded in the eye or in the cornea. And so especially if somebody's out welding or grinding, I'll get metal pieces where I take an instrument and then I actually numb the eye first. Oh, that would be terrible if I didn't. You can go in and then pull out the metal, and then the eye obviously feels much better after that. But I do that quite often. But a lot of times people will have, like the other day I had a patient that came in with a paper cut on the back of the eye, and yeah, or not on the back, on the front of the eye, on the cornea. And obviously not a good thing. And so we treat that and try to make it so it doesn't get infected. But that's actually kind of in general, an overall, just synopsis of the eye with the eye model, okay? Okay, and another question that I get quite often is sometimes you hear about people that are donors for parts of their bodies if they're ever like in an accident or if they can have parts used for other people. So currently the eye, if you say that you're a donor to someone, if you pass away, early or something, the only part of the eye that can be what they call harvested is actually the cornea, the front part of the eye. And so what would happen if somebody has like an eye disease that has the cornea is all misshapen or causing problems? If somebody were to pass away, you can actually, they donate their corneas, believe it or not. And so what they do is they have a little cookie cutter. It's a thing that cuts the cornea in the same size, and then they can harvest that. It can last for weeks, like on ice. It can stay good for a while. And then the people that have bad corneas, then they do the same thing with them under anesthesia. They'll actually take that cookie cutter, the same size, not the same one that they did with the cadaver, but anyway, they'll take a cookie cutter and they'll cut that out, and then they'll replace it with the cornea that's healthy. And it's interesting because then they'll like stitch that, and the people that do that are incredible. The stitches are so fine and just very intricate. And so anyway, so if anybody ever asks, I'm going to donate my eyes to science, and basically what they're talking about is just the front part, just the cornea. They haven't been able to do anything else with anything internally because it's all tissue that's kind of a living tissue. The cornea is, but you can actually keep it longer on ice. Anyway, so if that makes sense. Okay, so when I visit with patients about their eyes, at the very end of the exam, I always show them their eyes and so that they can see what they look like inside. Kind of a cool thing. I mean, technology makes it so that I can look in and show the patients. I used to look in the eyes with an ophthalmoscope, and I still do that. I look in the eyes, that little handle thing. Actually, let me show you here. So this is my ophthalmoscope. Okay, so I used to kind of look in the eyes just to make sure everything's all healthy. Okay, but nowadays with technology, we do the OptiMap a lot, or on everybody pretty much. And so now I can show the patients what their eyes look like. So in the back, like I mentioned earlier, so the three things we look specifically at is the optic nerve. So that hooks your eye to your brain, like I mentioned. And then the blood vessels, they come in and then they branch out. And then the macula, okay? So I've got a picture that I took earlier, or that we took, our staff did. And so I usually grab and show the patient. So, and here's kind of a dad joke. You can roll your eyes if you want, but this is an eye on my iPad, just so you know. Okay, so, but I know all my jokes are kind of cornea. So just so you know too. All right. All right. So crack myself up sometimes. My kids roll their eyes at me too as well. So, okay. So, so this is how it kind of shows up, and I'm going to kind of zoom in. So this is the inside of a right eye. Okay. So kind of zoom in, and in my imaging, you have the lashes, and then so these are the upper lashes, and then the lower lashes. Okay, because if you remember in your course, when you look in an eye, everything's upside down. And so what it does for me is it actually puts it right side up so that I can look at it like straight on. So if we zoom in, so we can zoom in past the eyelashes here. So I can take the eye, okay, and then I always show the patient, and I'll show you. So this is the optic nerve, okay. We've got all your blood vessels, and then we've got the macula right in the middle, okay. The reason why the macula is darker is because it's more sensitive. So that's where we see like straight ahead. And so all of the more cells are in that area. Now, if somebody were to have like macular degeneration, this area would be all splotchy. They would start off with like white spots. It looks kind of like calcium deposits or anything there, which would cause a red flag. But this is a very healthy eye. This is a healthy macula. Okay, then we also look for blood vessels. We want to make sure there's no broken blood vessels. And so sometimes people with like say diabetes, high blood pressure, thyroid, just different things can cause broken blood vessels. So that would be another red flag if we found that. And then we also look at the nerve. We just want to make sure there's no swelling or any kind of nerve damage. And so with the nerve, if there's any kind of swelling or nerve damage, it's usually what we call glaucoma. There are many people you might have heard of that have glaucoma. Now, glaucoma is an eye disease that affects the peripheral vision. Okay, so you start to lose your vision in the periphery, and not a good thing. If somebody were, say, had macular degeneration and glaucoma, that would be a bad combination because it's coming from the outside and the inside. We don't find that very often, but it's you know, we do sometimes. Then lastly, we kind of look at all the periphery out in here to make sure there's no tears or any kind of scarring or anything like that. But like I said, this is a very healthy eye. Now with this eye, just with the technology, kind of a cool thing, because I can take that and we can put the eye in 3D mode. Okay, so this is back to the right eye. And the computer then puts the iris and the pupil out in the front. Okay, and like you know with your anatomy, the pupil is just a window into the back of the eye. So that's how you see into the eye. And then we can take this is just kind of cool, is we can take your eye and this eye here and make it so that it's actually animated. So we can fly all the way inside the eye. And those of you that remember like the Magic School Bus, I think some of you maybe have seen that. This is my version of the Magic School Bus. So you can actually fly inside the eye and then look around. And it's kind of neat too, because when I used to do the eye exams, and even sometimes now, I would look in with the ophthalmoscope and I would tell patients, yeah, your nerve, your blood vessels, your macula all look good. But now I can actually show them in person that the nerve, the macula, everything looks good. And so kind of a neat thing to be able to do that with patients, kind of interactive. And so I'll keep this going. Now, one thing I can do, there's a lot of fun things with tools on this, but I can take this and we can make it so that it looks more like an eye. Okay, so I'll wait till it kind of comes around again here. Okay, and then when it comes back, I think I can. Sheesh. There we go. So I can add the white part of the eye. So we can kind of zoom in. I don't know what that little laser thing is. That's right. Anyway, so let's see. Let me take that one off. Yeah, that was an astigmatism ray. I have no idea what that is. Okay, so when I put this in this mode, like I said, it looks more like an eye where you can fly in. So you see the white part and then you fly into the eye and then look around. Anyway, isn't that pretty amazing? I just think technology is so cool. So anyway, so with that, that's actually now how we can actually show patients their own eyes. And it's kind of cool. I mean, it really is. And so anyway, so I hope that was okay to kind of go over a few things with you virtually. Anyway, I hope you guys have had a good year with your anatomy class as well as the eye part of that. That's my favorite. And anyway, so I have this here just to kind of show you in my office. It's Daddy's favorite eyes. So that's all of my 5 daughters and they all have their eyes. So if you know them at all, maybe you could recognize some of their eyes, but anyway, that's all those. So anyway, so one last thing, there's a lot of things in optometry that are very funny. I had a patient, anyway, and because you're anatomy students, this actually was one of the funniest things I've ever done or had involved with in my exam. Anyway, I had an older couple come in and neither one of them could hear very well at all. And so I did the exam and the husband was in the chair, the wife was in the room, just kind of there. And I was yelling the whole time, like, which is better, 1 or 2? And everybody in the whole building could hear me. And anyway, at the very end of the exam, I told him, I says, okay, you're not seeing very well because you have some cataracts and there's some swelling in the retina. Anyway, and so the wife was there and the husband didn't hear me. And so she was the one that interpreted my diagnosis. And she said at the top of her lungs, she yelled, and I'm sure, again, everybody in the whole office heard, but she said, honey, he told you you have cataracts and rectal swelling. And I said, no, you don't. I don't know that you do or not, but I'm an eye doctor. And anyway, my scopes don't go down there. You know what? That's another anatomy session. And so that was a day that I was certainly glad that I was an optometrist where I looked at the eyes rather than anything else. And so anyway, that's the reason why I'm an eye doctor. And anyway, my wife, she's so funny. She said, Carl, she said, what happens if they go tell all their friends, you know, hey, go to Dr. Carl. He does like a twofer and he's really gentle. So anyway, I know that you're old enough maybe to understand that and you've had anatomy. So sorry if that was offensive, but anyway, it was a funny moment in my history of my optometry career. So you guys stay strong. Have a great summer. Mr. Barris is incredible. So thank you for letting me be a part of your day. So have a good one. Take care. Bye-bye.